Hello.
Hello.
Hi, Mike.
Hey, how's it going?
Hanging in there.
These minutes, if I had any more room, I'd have more gray hair. I didn't like the minutes, but it's truth, huh?
You didn't like the minutes, you mean the report?
Yeah, the reports.
Oh, okay. Yeah.
Is this a public meeting?
Yes,
Yeah.
it is.
Oh, I love it. Good.
I think we're just waiting on Mark. Hi, Tommy.
Hey, Tommy. How's it, Tommy?
Hello. Hey, just so you know, I got to leave about 2:45 for a 3 o'clock hearing at the legislature, okay?
Okay.
All right, not a hearing, it's a confirmation I got to go with it for, okay?
You say it's a confirmation? It's your confirmation?
No, it's a confirmation for somebody else that I submitted testimony for. No, I don't have a date yet. I don't think I'll be up until like the 3rd week of March or so. That's my understanding.
Oh, okay.
All right. And we submitted the testimony we talked about for the budget bill, okay?
Thank you.
I'll send you a copy of it over.
Awesome. Thank you so much. I'm going to text Mark. Hi, Warden. Thanks for joining us. Good to see you.
Only me?
Just waiting on you.
Hey, Mark.
Oh, okay. Hey, Mike. Oh, there's everybody. Okay. Sorry, I'm on my phone today.
It's okay. We can hear you, but we can't see you, just so you know.
Okay.
So, Mark, you ready to get us started? There you are.
There. Hi, everybody. Sorry. I just came home because my generator at the facility went down. So I had to do this at home. So, yeah. Kristen, is it me or you?
It's you.
Okay. I'm shifting gears right now.
You have to convene us. You have to convene us.
Okay, special meeting. Martha is here. We're doing a roll call. Ted's here.
Here.
Mike?
Here.
Ronald?
Ronald is on. I saw him just a little while ago.
He's muted.
Okay. Here.
Okay, so all present. I called this special meeting to order at this time to discuss the February OCCC site tour observation. I believe if we want, I see the commissioners are all here with Christian. Who else we have in the room, Christian?
Tommy, Mick, Lance.
And then a couple of members from the public, I think.
Okay. All right, we can go ahead and start the meeting at this time.
And then a couple of members from the public, I think.
Okay. All right, we can go ahead and start where did you want meeting at this time?
And then a couple of members
Well,
from
just
the
the
public.
date that we visited and who visited.
Okay. Okay.
Right.
Sorry, you guys. We can go ahead and start having where did you want meeting at this time? Okay, so on February 16, 2023, the Hawaii first visit to one of our jails as a first time collectively to tour. We due to the size of OCCC, we split that into half. We haven't done the second part yet. The first part being mostly of going in and looking at the interior of the main facility. I guess a safe way to say it is the pretrial, the women, and some of the furlough aspects of OCCC mission. And present at the tour was myself, Martha, Ted, Ron, and Kristen. And we were escorted by the administration of the facility. Now, we wanted to come and have this meeting today to discuss some of our findings. As I'm going to assume everybody received the report. Did we post the report on the website?
Yes.
Okay.
Mark,
Yes, Ted.
Mark, I think we should note that this was a, what do you call it? It wasn't a public meeting because of the nature of the visit, the nature of the facility we were visiting. We had approval from OIP to, what do you call this kind of meeting, Kristen?
It
a limited meeting.
Limited meeting. Yeah, it was
a limited meeting, right? And after the meeting, we agreed that we would each put our thoughts in writing and forward it to Kristen, who would compile it. We would put our thoughts independently in writing and forward it to Kristen, who compiled it into the report that's now posted. So just for background's sake, Mark.
Mark, I'd like also to make a comment. The facility, which first opened in 1980, is in very bad repair, and that's no reflection on just the current administration. It became overcrowded within a couple of years of being opened, and the condition has deteriorated over the last 40 years. So a lot of what we're reporting on are long-term problems, they're not recent problems.
Okay. We have, this has been our first step into an area that we've not done before. We have experienced issues with the Office of Information in regards to our status as a commission, but we're slowly getting over it. And as we move forward, Tommy, through the continue to do these, I believe we're going to Kauai next week. We'll get better at announcement and having these meetings and what we hope to accomplish with having these meetings. We do understand that this is the old facility. Commission has stated that it needs to be replaced. But we really wanted to share, and these are just observations. Yeah, we just went in through that. We asked questions and we saw what we saw. Yeah, and through the different eyes on the commission, we had some concerns that we wanted to share, and that's where we bring us to today and see how in our fledgling relationship between the commission and public safety, how do we be of help in resolving some of the more immediate issues and have discussion on how we can help with the long-term issues. Yeah.
Mark, I'd also like to say that we were allowed to go wherever we wanted to go. We kind of said, can you take us now to the kitchen? Can you take us now to industry? And staff were, we talked with a lot of staff and with inmates, and we were not restricted in any way from doing this.
Yes. It was a positive visit in regards to our host that were there to escort us, whether it be the correctional officers, the medical staff, mental health staff, kitchen staff, operational staff. Everyone was very compliant to what we have to ask and share during this tour. Shall we go section by section, everyone?
I'm not sure how to proceed. I don't know whether we should just go to the recommendations because the report is available to everybody, or go section by section. It's up to what do other people feel about that.
I like the recommendations. I mean, for me, I'm sorry that I didn't go, but for 8 years, I was there almost at least monthly, if not weekly, as a parole commissioner, but I obviously didn't see everything you all saw. So I appreciate the report, and particularly the recommendations. And I'm going to be real interested in what, if anything, we can fix sooner than later.
Okay, I'm going to assume everybody has a copy of the report.
And I put the link to the report in the chat box for the public. I will note, I just noticed that I left the draft watermark of the report. My apologies, I'll fix that and re-upload it. But the link should be in the chat and everybody should be able to access it.
If we're looking at the recommendations that we have in regards to this first visit to one of our jails, let's look at the number one as being the OCCC issues with the Sally Port. OCCC should ensure the vehicles are or nor parked in the Sally Port unless in active use, and that the Sally Port gates are secured unless a vehicle is entering or leaving. The commission found that the Sally Port gates were unsecured even while inmates were being transported in and out of the facility. Sally Ports are spaces that are most at risk of having a security breach due to the direct access to the facility perimeter fences. It is important to note that escapes have occurred when Sally Port gates were not properly secured. One was from OCCC and one was from the First Circuit Court. Sally Port should always be locked secure unless a vehicle has entered or leaving the applicable gate.
That's something I put in, Mark, because it was very noticeable when we got in. When we first got to the Module 5 area, I believe there were 4 vehicles in the Sally Port itself, and both the front and back were open. And they were inmates in Module 5. And I think best correctional practice would be that the Sally Port should be closed. The gate should be closed at all times except when in active use. Later, when we were on the outside looking at the container cells, we noticed some inmates being offloaded from a vehicle, and the Sally Port, both gates were still open while the inmates were descending from the van. So we just wanted to point that out before there's an incident.
Well, Ted, I want to make sure Chris is aware. An inmate did, in fact, attempt to escape and got across the street and was shot and killed years ago. Was it 2-3 years ago?
Yeah.
Are you aware, Kristen?
I was not aware, no.
Yeah, it was really a tragic and preventable situation for lots of different reasons.
And this is probably the easiest fix of all the recommendations we have. Lock the Sally Port gates or close them.
I believe this is an operational issue. I can't recall at this point, Tommy, I know you have Mick and Lance here, but whether or not those gates are operated by the tower or by Module 5 itself, but I'm pretty sure there's an operational issue and procedures in place when vehicles are coming in through the perimeter through Module 5. Am I correct?
That's correct. The gate should have been secured whenever there's inmates being transported in the vans. So that is something that Lance is on the meeting, and so is Mick, that they'll immediately address with the watch commanders and the chief of security.
Okay. Any further discussion on the first recommendation? If not, I'm going to move on. Like I said, that's an operational issue that we brought to their attention. In regards to the container units outside of Module 5 that are used for quarantine isolation, should not be used unless there is a staff in the immediate vicinity at all times. The commission found that the containers outside of Module 5 do not have any ACO in the vicinity. The department places itself at considerable risk by not posting an ACO in the immediate vicinity whenever any of the cells is occupied. The ACO should be required to make regular, not less than every half hour, security checks of each cell and document these checks along with their observations. This ACO should carry the key that opens each cell door. It is therefore recommended that OCCC not use these units unless it can post an ACO in the immediate area whenever any cell is occupied.
Yeah, on that one, Mark, I believe it was a sergeant who was taking us through the facility, and he was the only officer with us. I didn't notice any officer who's actually posted in that area. I believe there were maybe 2 inmates in those cells, and we were informed. The thing that kind of bothered me was that we were informed that there is no communication system from the cell to anywhere else. So if an inmate is in distress, for example, in the cell, the only way to get anybody's attention is to call out or pound the door. And if nobody's out there, then it would be difficult for anybody to notice. The other thing was we asked to look into one of the cells, and the sergeant had to go back into Module 5 to get the key. Every cell door is keyed individually. There's no other way to open it. So if anything should happen and all of the inmates have to be evacuated immediately, an officer would have to get the key and then open each cell individually. So I think those are security problems that need to be addressed. And the only way I can see to address that, given the physical construction of the cells, is to keep somebody posted there in the immediate vicinity anytime an inmate is in a cell.
When we got those containers for use at OCCC, as well as in the other facilities, were there procedures written in terms of manpower and staffing, Tommy?
Yes, there were. I'll let Mick handle that one because we did the consultation letters when we purchased the containers. And if I'm not mistaken, we did set up temporary posts, if you will, when someone is in a container. So I'll let Mick and Lance cover that one. Okay.
That'd be interesting to note if they were designated red or black when those containers were full in terms of their post assignment.
Mark, this is Mick. The policies are there. There should have been somebody out there. I'm not sure what occurred, but it can be a discussion I'll have later. The officer should be out there when there's somebody in one of those cells. They should have the key. They should have radio. I'm not sure where the breakdown was on that day, but it'll get corrected. And there are post orders written.
Okay. Thank you, Mick. We're on the assumption most of the correction officers that we saw in and around the container outside of Module 5 were part of the transportation team and not so much the container.
Yeah. It could have very well been that. I mean, I'll have the chief to try to go back and take a look at, okay, who was assigned that day? Because when they have inmates in those cells, somebody is supposed to be out there checking on them for the very reasons that Ted has brought up.
Okay.
Just a small
Appreciate that.
question, Mark. These cells like these things, is just best practice? Is it national practice, or is just a make-do last-minute thing? What are we talking about here?
I think that this is Tommy. I think we purchased modular units at the time of COVID using federal funds, just as other jurisdictions did, as a way to isolate inmates who were either coming in or who medical determined were positive for COVID, and they were housed there to keep them away from the other inmates so it would not have a spread in the facilities. And so how the containers should be used, they should be used for intake, and in the place of quarantine, they should be used. Medical will be the authorizing entity to send someone to be housed in one of those units.
So is it standard practice now? Is it still a COVID exception, Tommy?
Well, we're still following the CDC guidelines, which still has us doing quarantining inmates who are intake and doing transfers. So the CDC is supposed to lessen those guidelines in May, we're waiting for that to come out. Until then, we still have to try to quarantine as best we can with whatever infrastructure we have.
So everybody in those units is a COVID person?
No, there are some initial intake we use to quarantine them, but if they're in the facility and the medical says they test positive, they don't tell us that. They just tell them to put the person in isolation, and that's what we do.
Because I'm feeling, Tommy, forgive me if I misunderstand it. We got our own self into the weeds here with this one. People shouldn't be in those units unless it's COVID. Maybe I'm missing something.
Well, we can't. If the problem we have is for those inmates who don't want to test when they come in, we can't force them to test. Then we have to have some way to quarantine them so that we can make sure before we introduce them to the general population that they're no longer infectious, for lack of a better. Okay.
That's an interesting twist, because I was under the impression that people were only placed there when they tested positive for COVID, as opposed to those who refused to be tested being placed there. Also, on top of it.
Yeah, it's funny for the guys who are coming in who refuse to be tested initially during intake. Then if we have the space, we use that as a quarantine facility, if you will. So they stay in there for the 10 days, and then if they don't have symptoms, and then they go to the general population. But if they're already in, and if they're in a facility and they refuse to test, then we don't put them in those cells. We try to move them within the facility itself. But if they do test positive, then medical can say, okay, move Smith over to the containers, and we will. They really have helped us. I know they're not the best solution, but they really helped us try to manage to best we can the outbreaks we had during the later part of the pandemic. Like we had 3 outbreaks at OCCC. The containers helped us during the 3rd outbreak because we had some of them up and ready to go then.
Yeah.
There's a question. Oh, I'm sorry. Go ahead.
Go ahead, Martha. No,
I was just going to quote the question in the text box where Sophie is asking, why are people refusing to be tested if they're already known to be going? They will be going to quarantine. Do they know that they will be in quarantine if they don't test? So are they informed of that?
Yes, and we did do a vaccination incentive program that we still have, where we pay them $50 for initial vaccination and $25 for every booster shot. That helped us more than anything else, to be perfectly frank.
Yeah, but
some people just don't want to. Some people don't want to be tested at all. They see stuff on the internet.
Okay.
Family members, and unfortunately, they're misinformed. And so we can't force them to be tested.
Okay, that was the question.
Yeah, I wanted to comment, Mark, that I think I understand that this is a very difficult situation that the PSD and OCCC are facing right now. There are some real issues regarding the use of that space, and I think OCCC is trying to cope with them. For one thing, it's completely open air. There's 2 containers with the cells, and there's no real shelter. So if an officer is posted on out there, he would be in the sun during the day. If it rains and it's mealtime, then somehow they would have to get the meals to the inmates through the rain. The shower is outside of the cells, or if the inmate has to go to get a shower, the inmate would have to be released from the cell, walk down through the open air to the shower itself. So, but I understand that it's a very difficult situation, and I think the most important thing is make sure that somebody is out there, and I think it's the best they can do at this point. Far from ideal, but I for one understand what the department is doing here.
Tommy, just to clarify, most or all individuals that are assigned within those containers have had access to medical, and medical is making those recommendations for the housing, whether it's positive or refusal.
There's 2 different categories, Mark. One, where medical makes the recommendation that the person goes there because they tested positive. Two, because they're just coming in and refuse to test. And so that's a quarantine site for us. So I wanted to make that distinction.
Okay, so my question was, does the refusal happen at the security level?
The refusal happens at the intake.
Medical.
At intake. So in intake, medical is part of the intake screening. And so medical's
okay,
to
that's
them.
what.
Yeah. We're good? Okay.
Yeah, we're good.
All right.
Thank you. I know, and I remember talking to the chief saying, as long as you're under those CDC and pandemic slowdown standards, we have to operate the way we do.
Right.
Right? In terms of isolation, quarantine.
That's for the safety and the health of everyone. Yes.
From your perspective, is there anything in sight as far as normalcy in our correctional setting based on CDC recommendations?
Well, to be honest with you, we did talk to the AG's office, and we're waiting for them to get back to us about how can we reopen without how can we slowly reopen the program without exposing the state to litigation. So we're waiting for word back from them. But I did meet with Mick. I met with Dr. Takanaka. He's our correctional healthcare administrator, because my concern is that inmates are not being able to complete programming. Not being able to complete programming, parole may be denied. But we're kind of stuck in a rock and a hard place, because if we open up and inmates get sick and some unfortunately pass away, then we're open to litigation if we don't have some leg to stand on with respect to some guidance to go by. And so I'm waiting for Craig Eha to get back to me, but we're hoping that the CDC guidelines that come out will lessen the restrictions for us, because while the CDC lessened the restrictions for the community, they did not really change for the jail and prison settings because of the nature of the closeness of the housing units and people are bunched together. So we still have certain restrictions in our epidemic plan that we are adhering to, but it's the CDC guidelines.
No, that says a lot, Tommy. Thank you. Out of curiosity, has the CDC has opened up our hospitals, though, right?
They have to some degree, and some hospitals have more stringent requirements in place because that's just what they want to do. But yeah, they have opened up some. They have opened up quite a bit, particularly in public settings, like in restaurants and in venues like concerts and stuff like that. Yes.
Okay. Thank you, Tommy. Let's move on to number 3. If there's no more further questions, number 2. It's a bigger. The medical infirmary needs immediate attention by PSD leadership for various issues directly related to inhumane conditions. The commission found that the infirmary is seriously overcrowded with inmate patients sleeping in beds in the common space, which is also contributes to a serious lack of privacy.
Mark, I'm sorry. You got to go back up one, module 19.
No, we're down at the recommendations, Mick.
Oh, okay. I'm sorry.
Page 5, Mick. Yeah. The commission found that the infirmary is seriously overcrowded with inmates sleeping in beds in the common space, which also contributes to a serious lack of privacy when discussing federally protected methods. The commission also found that the lack of electronic health records is a source of serious strain from an already burdened staff. Lastly, the commission found that the bathroom located in the infirmary is not ADA compliant. It is therefore recommended the infirmary receive immediate attention from PSD leadership to find solutions to the following: lack of privacy, lack of ADA compliance, lack of appropriate bed space, lack of basic human conditions experienced by the most vulnerable and medically disabled individuals in the facility, and lack of efficient caused by non-functioning medical record system and complete reliance on paper-based system.
Like in one area of the actual infirmary part, the staff told us that they couldn't make a change to some structure there because it was load-bearing wall, and it wasn't. It was just a freestanding thing. So, I think someone needs to look in if they could make some changes in that area. I also want to say as bad as the conditions are for the inmates, it's also very bad for the staff that works there. And they were vocal about the problems that they're facing, such as no privacy at all. That when doctors or nurses or others are interviewing inmates, everybody can hear what's being said and often can see what's happening in that examination. And the records room, I mean, the whole unit has become a records room. It's just the records clerk is trying her best to keep up with this, but there's no way that one person can keep up with all this. I mean, the working conditions are as bad for our employees as they are for the inmates.
So is this where you guys want me to chime in or what? If you've been to OCCC, you've seen that we're limited in infrastructure, so we can't really build walls without the fire marshal's okay and putting wiring. The wiring for OCCC, to some degree, in some areas is not up to code because parts of the facility are just old. I don't think it was built to be, that area was built to be an infirmary per se. And if it was, then we have outgrown that decades ago. So the staff is trying the best they can with what limited infrastructure we have. It's not ideal, and maybe it's substandard to some degree, but the bottom line is we don't have anywhere else to put them. We can't make any infrastructure changes to the building without lessening the space that we currently have, because where we put those inmates now, and we're working on the electronic records management system. They do have a temporary process in place. Yes, it's cumbersome. Yes, it's time consuming. Yes, it's frustrating, but it's kind of limping us along until we get the new system in place. But I would like to say this is not something that happened over the last 5 years or 10 years or 15 or 20. This is something that has been around for a long time. All correctional facilities and public safety in general has simply been underfunded with respect to repair and maintenance and CIP projects. All the facilities are currently past their lifespan by decades, if not 50 or 60 years past, like Hawaii and some of the other facilities. So
they're not 50 years old. They're not even 50 years old.
No, I'm saying that some of the facilities are old and antiquated, as you can see, and we put up temporary buildings here or there. But let's just stick to OCCC. OCCC, let's face it, there's very limited. We're very limited in what we can do there. But I do think we can do this. Once the females move out to WCCC, when the new dormitory is done, OCCC becomes all male. We will then be able to spread out some, and part of the plan is to look and see if we can expand the infirmary to other places within OCCC where the females will then vacate. Then we can create. It won't be ideal, but it will be better. And so I will work with Nick, and I'll work with a healthcare administrator on that. I think we can come up with a little bit more space and maybe come up with some type of curtains for privacy. But I don't think we'll come up with a kind of a hospital setting with individual rooms where nobody can hear anything that's going on. But I do think once that move takes place, I think we will be able to provide additional space and address some of these privacy issues that are real. I don't disagree. I really don't.
But one of the problems, Tommy, is I know you get concerned, and you should be, about possible litigation. Sophie brought up again, if everybody can hear everything's going on, you're not able to abide by HIPAA.
Mm-hmm. You know, and it's been like that for years. Unfortunately, I'm not trying to say that we shouldn't do anything. I'm trying to say we're trying to do the best with what space we have. We can't do anything until we have additional space, and since we can't build that quickly, the only thing we can do is once we move the females out is look at trying to expand the infirmary out where they can have some degree of privacy, and maybe even an examination room where they can talk to the doctors and the nurses and have some privacy, and then go back to the bed space that we might have for them.
Well, I hope that works out for you, because that'd be great if you use one of the smaller modules as the infirmary.
Right. I think it's a distinct possibility, but I'll keep Christian up to date on that. And I've been keeping her up to date on the electronic records management system as well.
Thank you.
Tommy, is this something that you might want to explore with the Department of Health or with the hospital corporation, whatever their name is, the one that runs all the state hospitals, to see if they have any space that could be converted into a correctional section? It might cost you, but it might be worth exploring, because this is not something that you're going to resolve in the next 5 years or so.
Right.
And I think even at OCCC, I asked Lance specifically, well, how do you plan to use the space that the women vacate? And he has some ideas also. And you know, it's a tough puzzle that he's trying to fix. But if you can get, say, if there's vacant space at Leahi Hospital, and you can get the appropriate staffing to create almost like a correctional ward there, it would add to the space that you have at OCCC.
Okay, yeah, Ted, there are some discussions regarding additional space in another location. I'm not at liberty to discuss that now, but there are some discussions along the lines of what you're saying at a particular location.
Okay.
Thank you.
So, you know, when I originally saw this, Tommy, you know, it just reeks of a lot of decades of what it is and systemic issues. And no real overnight solution. So the fact that you had some thinking of what can occur down the line is good right now, because we all recognize the problems in the medical unit right now, and we just continue to work on ideas, and we want to be able to help too. Thank you, Ted, for that as well. I passed WCCC today. I see they're laying the foundation for the buildings. So, and I think the building on Ahiki is already have walls. So it looks like it's moving along quite quickly in terms of the construction efforts. But the medical unit and everything that we just projected, it's going to take time. We understand that. But thank you for
I do have a question. Tommy, when we did our 2001 space analysis, at that time, all our medical units were accredited nationally by the National Commission on Healthcare and Corrections. Do you know if any are accredited this time?
I think we started the process. I can check with Gavin, and some of our locations that were previously accredited were re-accredited, but I can check with him and I can give that information to Christian on the previous accreditation and then which locations are currently accredited, and then the status of the remaining. I can provide that to Christian.
Okay, thank you.
Yeah.
Moving along to number 4 on our recommendation. Cells that hold individuals on suicide watch should be painted and reconfigured for a more therapeutic environment for those who are in crisis. The commission found that suicide watch cells were covered in graffiti. In addition to having a large metal slab to be used as a bed, inmates would place their mattresses on either side of the slab. The commission recommends the slab be removed and the cells receive a fresh coat of paint. I think a lot has changed in regards to how we housed our suicides. I recall asking Lance, how come there were 2 in the cell? And I believe someone gave the answer that's been proven that if there's 2 in the cell, they're less likely to commit suicide. Is that something that is why there are 2 in the cell?
Well, that's part of it. The other reason is we only have so many suicide cells. Yeah. And I'll give you a case in point. We had at one point in OCCC about 24 people a few months ago on suicide watch. And once someone voices suicidal ideations, then we have certain protocol we have to follow. And unfortunately, not all of them were actually suicidal. They wanted a housing change, but we still have to follow the protocol. And so part of the reason some might be 2 in a cell, that one reason is because, they're less likely to commit suicide. But the other reason is we just don't have any places to put them that are set up to where there are no nubs or nothing that they can hang themselves on.
Okay.
But I can also tell you this: if we're looking at if the recommendation is to remove the slabs, if we do that, that's a major project that shuts down that space for a considerable amount of time. So I think the fresh coat of paint is something we can take a look at. I think, though, that like with the sensory cells we talked about, Mark, I think if we can create a better environment for people in crises and people who are terminally ill, I think it can go a long way to kind of ease their mind and kind of bring down the temperature some. So we'll take a look at the painting of the cells. I think the removal of the slab is a little bit more complicated, but I don't disagree that we need to have modern suicide cells and modern sensory cells for those who are terminally ill.
I recall at one time when I was a captain there, and this is for Tommy, Mick, and Lance, that there was a more of a, well, when I was there, I didn't see any mental health presence. Are they no longer stationed in the housing units? In terms of PMAs that we used to call them back in the day, or psychosocial workers?
No, I'll let Lance and them answer that, but we do have PMAs at OCCC in the mental health units. Go ahead, Lance or Mick.
So at this time, hello, can you hear me? So at this time, yes, the increasing of PMAs, the mental health has hired more PMAs. Programming, they have increased a lot more programming. They have a lot more programming staff. Don't know why. Like I said, I couldn't answer why at that given time, that particular time, they are not. They weren't in there. But most of the time, their program is all day from second watch and third watch feedovers. So they have an X amount of hours that they need to establish for open housing programs for these inmates.
Mark, I had a comment.
Go ahead, Mike.
Yeah, in the O'Malley decision decided by Judge Tanaki, where Joey O'Malley committed suicide, Dr. Pablo Stewart said that the procedures were in place sometimes, but it weren't followed, and the training was difficult. And I think that's good. The procedures are there, but the suicide thing it's got everybody very concerned. And aside from the fact we need a new training, Tommy or Lance, do we have a training director now? And is training ongoing? Because the O'Malley decision was a train wreck. It was a fatal outcome that was preventable. I don't need to go back over that one, but I want to make sure training is happening.
Training has been essential. Through COVID, it's been difficult. But we have had meetings from last week for recertification, and that's number one on the table at this time. From CPR to mental health training to first aid and crisis intervention. And that's right now the number one discussion, trying to get everyone back on certified status for training. So every individual within the facility, inclusive of program staff and security staff, needs to be trained to work in those types of environments.
Yeah, Lance, again, forgive me. I don't know if this is a good question or not, but are you in discussion with Pablo Stewart, or is he collegial, or is that a different kind of relationship?
We have, the facility itself has not. I don't know too much where Wendy, the administrator for medical, that at this time is going for research, is in contact with these types of resources or agencies.
If I might, Dr. Stewart would work with Gabe and Dr. Takanaka regarding any concerns he might have. Dr. Takanaka is our correctional healthcare administrator, so he would be the one responsible for the training and recertification of healthcare-related staff and healthcare-related subject matter. What Lance is referring to is the training for the psychosocial workers, the social workers, and the staff with our TSD training services division and our training sergeants at the facility, correct?
I mean, there's also a requirement, as I recall in policy, that any officer who is assigned to certain posts, such as a mental health module, needs to complete certain training. I believe mental health modules, perhaps the holding unit, places like that where
that is correct. But during COVID, some of the certifications lapsed because we weren't able to get the people together. So now we have an updated list from our TSD of which certifications have lapsed. And we have a plan in place to try to get everyone brought up to speed. Go ahead, Mick.
I guess, following up on Mike's earlier comment about the O'Malley case, we would hate to see an incident happen and lack of training be cited as one of the causes. So that's why we're continuing this discussion.
Yeah. Okay. Thank you. I'm going to have to go to the legislature for this for the hearing, but Mick and Lance are here, and then Christian, I'm sending something to Gavin now. I'm CCing you about the accreditation question. Okay.
Thank you.
All right. Thank you. Thank you, everybody. Bye bye.
Thanks, Sami.
Just one last question, Lance. Your suicide population or numbers, they're pretty consistently at the numbers that you have. I mean, a lot of your suicides are just coming off the streets, or how would you best describe that?
So from my experience, mental health has been very accurate with the suicides, the actual strict suicide. The influx of intakes coming off the street requesting certain special housing and not getting certain special housing and screaming suicide increases the numbers, so that the numbers are not as accurate as it should be, because you have these inmates trying to manipulate and utilize the suicide protocols, knowing that they will be rehoused temporarily until assessment and evaluation is completed. So that brings the numbers pretty high, and it's not as accurate as it should be when you look at the numbers. But in regards to mental health, being on it and assessing accurate and addressing the strict suicide and safety watch inmates, they're pretty on it on that part.
Yeah. So it's safe to say that that particular portion of your population or mental health is a significant part of your suicide population.
Yes.
Yeah.
They are pretty accurate on that.
Okay. Thank you, Lance. Any further questions on number 4? Number 5, those housed in protective custody status should be allowed all items usually authorized for general population inmates. And I think this is in regards to our visit to the segregation unit. The commission found that the PC inmates were subject to the same condition as the inmates on disciplinary segregation. Held in lockdown with hardly any activity, individuals who are in PC are a vulnerable population that should not be punished for requested additional safety precautions. Individuals on PC should be housed in the least restrictive environment practicable in segregated housing only if necessary, and in no case in a setting that is used for disciplinary housing. Additionally, PS inmates should be allowed all of the items usually authorized for general population prisoners and provided opportunities to participate in programming and work. PC inmates similar to general population inmates should be provided the greatest practical opportunities for out-of-cell time.
So, Mark, with COVID, that had taken away our, and we don't really have a PC program. If they meet that criteria, they are shipped to Alava in a PC unit where they do have all those amenities. We have at this time what is called alternative housing to address these inmates because Module 7 was taken away for our COVID isolation overflow. But with that said, we are already trying to sit down and think of how we are going to establish our own PC program, which, like you said, will have all those non-punitive amenities afforded to all these types of inmates.
Will Halal take a pretrial? I'm sorry, Lance. Will Halal take a pretrial PC?
Yes, they have been.
Okay.
But we have been very really pinpointing who really needs to be there where life and death is really imminent. These other types, most of them are just my crime. There's no imminent danger where they have specific groups, factions, or any specific person that's, I guess, not addressing, but have something that's holding against them that they really will go out and get physically hurt. So right now we're utilizing areas for the holding unit as temporary alternative housing. We try to address it as best we can. We give them outdoor rec and a lot of the phone privileges. But yes, we have to address that conversion back to Module 7 after, and I'm hoping soon COVID is lifted. Yeah.
If Mark, can I ask a quick question about that?
Yes.
So, Warden, this is something I'm pretty concerned about. This is within department policy that people within protective custody should have the same rights as general population. And I hear what you're saying about making sure that the people who are in PC need to be there. I understand that too. That's also pretty explicit in policy. And so my concern is, because what I've been hearing is the HCF is consistently full, like their PC unit is consistently full. And if that's the case, and if you are going to make the current makeshift PC unit into an actual PC unit, I'd really, really like a specific timeline on when that's expected to be done and completed. I'm not aware of any type of construction that would need to happen for that. I think it's just a matter of making sure that they receive the same access to programs, like you said, like rec, phone call, et cetera, et cetera. So, like, is there a specific time frame that you think that could happen?
So Christine, prior to COVID, Module 7 was that housing specifically for that type of inmates. And we had no problem. It was fine. In fact, sometimes some of the inmates went in there and kind of malingered and really, so we had to, every so often we would reassess and see really who fits that criteria. But Module 7 is, and I'm hoping, right now we've been stabilized without no positive isolations. It's been very low. There's no overflow, that we need more housing areas for the isolations. So I'm hoping a month or so, we would be able to reopen that Module 7.
Do they have to be in Module 7? Like, why can't the current unit that they're in be considered a PC?
It's the number. So it's the numbers. Right now, they're specifically in the holding unit on the first floor, right? And we'll open them up and we'll try to get them out as much as we can. It's just the numbers, but sometimes the numbers can dwindle down to, I would say four, and holding a 40-man or 40-man housing for 4 inmates, it gets kind of difficult. we talked about design, very difficult, with the new specs on design. They have these protected glasses where in the housing, they could split up the whole module into like 4 to 8 areas. And now you have smaller areas that can go out, and it's feasible to have that type of inmates and that population there. And at this point, we're not lucky enough to have that. So holding up a full module for 4 inmates at this time. And that's the reason why we decided Calava would be the holding area for our PC. They have a PC. They'll be mixed up with other pretrial PC inmates, and they have a little bit more design that can fit that criteria.
I think the issue is, though, Lance, you do have them in the holding unit. They should be having access to programs. And this would be more a general question that I know that Tommy is gone, but in the past, we relied a lot on volunteers providing different programmings to the inmates. And so even if it was volunteers coming in, because they wouldn't have to see the other inmates that are on the top 2 floors who are in disciplinary seg, they would only be meeting with the inmates on the bottom floor. So, even if you have 1 inmate in PC, they're still entitled to all these programs by our own policy.
Yes, I agree.
Yeah, and I guess that was my point. Like, I understand you're limited, but ultimately these people need to receive the same programs as general population. So that's what I wanted to make sure was happening. And that's what I'm asking about when I'm asking for a specific date of when it will start happening.
We will look into that and see if we could fast track that and have Module 7 reopened as our PC.
Lance, I think Martha's point is, why can't you start to open up more within the holding unit itself, because the status of these inmates, I believe there were 4 of them, requires that you do so. Not only the policy, but every standard that you can look at will tell you that PC inmates should be treated just like general population inmates. I recall, and some of you may correct me if I'm wrong, but I recall that the officer in the holding unit said everybody gets treated the same in this unit, regardless of their status.
So at one given time, we did start up addressing more, such as store orders, radios, and other books and items. When we start that up, sooner or later, those items that were privileges to these inmates, this little area, would end up on different floors and different areas. So we had to go out and backtrack and tighten up the protocols in the holding unit again. But I agree. We have to look forward, and we need to go out and establish and reestablish that housing in Module 7. But yes, we did try to accommodate by putting more items in the holding unit and program this population. Like I said, eventually the privileges got, I guess, misused, and it kind of went back, and we tightened up the ship again.
I think we're going around in circles in this argument. We're not going to resolve it. But I do want to make one other comment, Lance. I was appalled at the recreation area for the holding unit, that they basically were cells on the outside. It isn't just that inmates need to have sunlight and get vitamin D. They need to be able to do large muscle movement. And those cells do not allow for that. Those outside rec cells. And I'm very disturbed by that.
Hey, Martha?
Yeah?
Question for you. When we Now, the cages were put in outside because when we would release disciplinary seg out there as a whole, they were beating the hell out of each other. So we went to the cage. Those cages had fit the norm for large motor exercise.
I don't
Now
see.
you're saying they don't. So could you
No.
define what large motor exercise is so we all are thinking on the same page?
How about being able to run or walk a distance besides 10 feet?
The large motor exercise would be jogging in place. This is disciplinary seg, Martha.
No, we're talking about we're talking disciplinary seg, but also the PC inmates.
Correct. I agree with you, but the PC is inappropriately placed in an area because we really have nowhere else to put them.
Mick, I'm not going to start arguing with you about what large muscle exercise is. I don't believe these accommodate that. What could be done is you put larger cages that you may have 4 or 5 of them instead of all these individual ones where they're not mixing with each other, but they can still get around. I mean, at Halava, they give them a ball to go into a large area. You can't.
They have a better designed facility for that. I wish we had that.
You consider resolving this. It's not right.
No, I agree that it could be much better. I'm not sure when the new OCCC was built, why they retained a 1920s holding unit.
1936.
Okay, 1936, close enough. I mean, I would have thought that they would have, built something new to go with the new design of the institution, but they didn't. It is difficult, but we agree. We'll try to discuss what a solution can be. If Module 7 goes back into that PC type unit, that may be the solution for the PCs.
Mark?
Hey, Mark here?
Yeah, go ahead, Mike.
Yeah, I'm a professional mediator. I suggest what we do is we let Mark and our suggestions come out. We don't need to resolve them here. We don't need to get down in the trenches on this one. I think that the staff needs to hear our concern. If we want to hear a response, fine, but I don't think we're going to solve it today. I don't want to go around the circle too often. I agree with Martha.
Mark, may I say something? It's Ron.
Go ahead, Ron.
Okay, why don't we put this on the meeting for next month agenda, update status, just like we should put the EMR, emergency medical records, on each month, asking PSD to report to us the status of their efforts.
I agree, Ron.
I think that's a great idea. And if I can sort of expand it a little bit, I didn't really comment on this, but I am also concerned about the inmates who are placed in those quarantine cells outside. They have no opportunity for any kind of activity. Also, we'll come to this, but the inmates in the larger quarantine module, and this is where they're housed 4 and 5 in a cell, have no opportunity for activity. And I think it's a big picture. There's too many inmates at OCCC who are sitting in the cells without getting out.
Ron, can I ask a quick question? For the update status, you're talking about an update for each one of these recommendations that are listed, or are you talking specifically?
The ones that we need to follow up on specifically, the program for the protective custodies, and any other issues that we raised. That
are you guys hearing me?
We can hear you, Mark.
Hello?
Yes,
Mark, you're frozen out. I think because he's on his phone, he lost the connection.
Martha was a de facto, coordinator chair.
Yeah.
Martha?
Did we lose Martha too? Martha's muted for once.
Once.
I can say that to Martha.
I was going to say, Ted, you should be nice.
Yeah, Martha and I go back a long way.
Now, what did I miss? I went to the Lua. What did you
Didn't
say?
miss anything, Martha.
Martha, we're asking you to be the de facto chair because I think Mark had lost connection for a moment.
Oh, I was in the Lua.
The last status was on these things that we need to follow up with PSD, that we list them on the next agenda meeting and every meeting thereafter, so it doesn't fall through the cracks.
Yep.
I agree with that.
George and I made a note that will happen. So Martha, I think we're on number 6 if you wanted.
Yes. Okay, the housing unit windows that are which are covered by wood should be replaced by frosted windows to allow natural light. And natural light is one of the requirements of ACA standards. And all inmates' room cells provide the occupants with access to natural light by means of at least 3 square feet of transparent glazing plus 2 additional square feet of transparent glazing per inmate in room cells with 3 or more inmates. Therefore, the commission recommends to replace the wood with frosted windows to allow natural light. And for those of you who didn't read the report, we found in many modules to stop communication between inmates from one module to a rec area or from one module to another. The facility has covered those windows with wood, so there's very little natural light in many of the modules. Comments from corrections?
Martha, I would only say that I think at least for sure, knowing the ones that were put up to stop the female-male type interaction could just come down when they're out. I do know when I was there, we had to replace a few windows inside the module. They're about 6,400 a piece. We can try to see if there's, I don't know if they come in frosted. They probably do, but
yeah, they do.
It would be a matter of coming up with the money to do that.
Well, it's something I really think you folks need to think about. And it wasn't just the women's module. There were other modules that the windows were covered with wood.
Yeah, I understand.
Any other comments on that subject?
Oh, it's pretty clear.
Okay, number 7, food must be served at appropriate temperatures to prevent foodborne illness. The commission found the food was placed on plates directly from trays that were not on appropriate warmers. No one was observed taking temperature of the hot food on the trays or the food on the plates at appropriate intervals. This leaves OCCC at the risk of foodborne illnesses caused by food served in inappropriate temperatures.
Yeah,
Ted.
Oh, yeah, I put that one in because I was observing the plating of meals that were going to be pushed out to the housing units. And the hot entree was simply on a tray on a table and plated directly on the plate. The plates were put in the cart. I don't know if this was a cart that could maintain the temperature, but the requirement is the food has to be at certain temperatures. Hot food at certain temperature, cold food at certain temperature at serving. So when they get there, on the other side, somebody's supposed to take temperatures also. Obviously, we didn't observe that, but I thought I'd raise that because the last thing you guys need is some foodborne illness where an entire module gets sick. This one is on food service. It may be a matter of getting equipment and training the staff and the inmate workers to do it properly.
We'll continue to work with the food manager of the facility and ensure that we meet compliance.
And Lance, this is something that also the food service manager down in administration should be helping with, not just you alone.
Yes, agreed. Thank you.
May I follow question, Martha? Just Ron.
Yes.
So Lance, is there a separate Department of Health inspection that go through the facility to inspect, the food service and other sanitation conditions?
From what I have heard in the past, yes. I don't know the time frame of that, but I know they have passed through to do inspections.
And do they provide a written report?
Yes, they do.
And can we have that report also?
I will make contact with the food manager and try to get that report.
Not only food, but other general sanitation conditions?
That Department of Health may be looking at, yeah.
Thank you.
Sure.
And Lance, anything you forwarded to Kristen?
Yeah, to the commission, yes.
Thank you.
I use your name in vain. Forward it to Kristen. Fill up her mailbox. Not that it's not full already. Okay.
Mark, are you with us?
Yes, I'm here.
Oh, okay. Oh, laying back, letting Martha do the work.
Oh, Mark, get on board again.
No.
He said no.
I know. Can you hear me?
Yes.
Yes.
Okay. There's so much to say about food. But I do know there was a process of managing temperature when they leave, and there was a responsibility to the staffing in the housing units to monitor, to write on a piece of paper, this is when they arrived, and
right.
All of that was documented. So really just need to look at, what was the policies and whether or not it's being followed. And I can assume by looking at the state of the kitchen as well as the equipment that there's a good possibility that the carts that they're using are not up to date. Ted, yeah?
Yeah, I agree, Mark. I think somebody needs to look at the equipment again.
Yeah, so, that's a systemic issue. I'm sure throughout all the jails, but let's move on to number 8, okay? And these are the contact visits that we observed. Well, we didn't observe, but we saw the place where the no contact visits have been created. The commission found that OCCC has not offered contact visits in at least 3 years due to COVID-19. Now that visitors can be tested for COVID-19 and required to wear a mask, it is important to allow contact visits. There is extensive research that highlights the importance and rehabilitative factors of contact visits for those in custody. Contact visits allow inmates to feel closer to their loved ones and their community. Non-contact visits are inherently punitive and, again, therapeutic and rehabilitative in practices. So I do recall that the chief saying that visits are 7 days a week. Yeah. And that there haven't been a cancellation of visits since this was implemented. Correct me if I'm wrong, Lance or Mick, but that's what we were told by the chief, which is a good thing. At least the visits are being run. And we understand that shortage of staff is why no contact visits were kind of, I don't know if I want to say done away. Is this a temporary issue on the side of OCCC, or is this the way things are going to be done in regards to visits with family?
From my understanding,
after we had found that it reduced a lot of contraband introduction, I mean, I think I agree, probably contact visits are your best bet, but they also do pose problems for us. And I don't want to put my chief on the spot. I wasn't there when the discussion took place, but I do know there have been some times where visits are canceled, but there are times where there's only one person on the list to come in. because it's opened up 7 days a week, you don't have that big long line like we used to have on the Saturday, Sunday only. And so that actually improves things, but there have been times where there's been shortages of staff that I know they call the person specifically and let them know before they come that the visit had been canceled. And then they have an opportunity if they want to reschedule that visit. But, you know, I think from a lot of our people, they wanted to stay with the no contact visits. It did help. But it's a discussion that we certainly can have.
Yeah.
And I think as a commissioner, most of us feel very strongly that contact visits should be taking place. Human touch is very important to the human psyche.
I think the key word that we just heard from Mick and that we as a commission already know, the vacancies and the staffing issues at all the facilities right now. Whether or not it's a good excuse, it is what it is. And if you don't have the staffing, you can't manage some of the programmatic wishes that we want to do. So
yeah, Mark, and two, a catalyst for a lot of that is it also though had. I mean, I don't know if it really stopped anything, but having the no contact with the glass in between during COVID was probably a best practice as well. That's kind of coming to a close though, so.
Right.
And we also are well aware that contraband can come in many, many different ways. So to just focus on the visits is not appropriate.
Well, and I agree with you, Martha, that it can. That's only one place that it can come through.
Okay, thank you for that. Let's move on to number 9. Maintenance should have a prioritized list of items or matters that require repairs and share the list with downtown leadership with specific timeframes of anticipated repair. Now, the commission found various areas where maintenance was needed. This is particularly meaningful for cells that were out of commission due to needed repairs. Given the immense overcrowding OCCC is experiencing, it is imperative that cell repairs happen quickly and efficiently. Staff had noted some areas of repairs that had been out of commission for months or years. Department of Public Safety leadership should be monitoring required repairs closely and issue timely repairs. Has there ever been a request, like CIP, Mick, that would request for funding just for the basic replacement items for our, say, for example, our lighting systems or our plumbing? Most of the toilets.
Part of the maintenance budget.
There is a CIP that is requested for those types of repairs. Is it enough to go through every facility? No. Right now we're focusing on getting a major list out of HCCC to do a lot of the repairs there. And then we're looking at, even if necessary, sending crews over to focus on certain areas. So Kramer told me today they have the list. He's trying to put it in some sort of an order in a spreadsheet. I don't know how much the parts are going to cost us, but we were trying to focus on that since obviously there is some needs in that institution, but we do know those needs are everywhere. And, it's unfortunate. I'm not sure right now if we're even we're able to do things, but I don't know if we're going to be able to even get the money to get us out of the situation we're in. Things have been kind of wore out. And when you haven't, Ted and Marta and various entities would understand when you architecturally design a facility for 500 inmates, but you put in 1,000 or 1,500, the engineering goes out the window. Everything is ×3 rather than times what it was engineered for. Things wear out quicker. And some of those systems are big. The plumbing systems, these aren't cheap fixes. The electrical systems, outdated electrical, parts of the problems of trying to add on to facilities when it really wasn't initially a part of the architectural design. We do our best with what we have, but right now the big focus was on HCCC initially. And we do have more funding coming July 1. I've been trying to work with CIP to prioritize those things that are more related to direct conditions of confinement instead of a parking lot or something of that nature. So we're doing our best to try to oversee these systems now and get the monies toward to create a better condition of confinement for every institution. It's just, we're never going to buy ourselves out of this problem I think we have right now, but we can improve it. And one last thing I forgot to say, and it may not be the best, those steel or metal frames for the beds in the suicide watch, they were put there because you had to have a place to be able to use therapeutic restraints if they're ordered by the psychiatrist. Does every cell need them? Maybe not. But that's why they were there.
Yeah, I know exactly why they were there. They still have the loops for the restraints on them, actually. Yeah. But quick point of clarification, Megan, thank you for that. I know you mentioned Kramer and HCCC because I've been doing a lot of work at HCCC and asked for that maintenance list of prioritized items. Would that also be possible for OCCC to get a similar list like that of prioritized items and definitely focusing on those conditions of confinement like you mentioned? I just want to make sure that
I don't see why every facility couldn't create a list. That's not unreasonable. It's a matter of them then being able to get the funding to be able to start fixing everything that's on that list, starting with the most important things and working their way down.
Nick, this is Ron Ibarra. So my understanding when I was a managing director for the county, CIP is for the big stuff. Yeah. And you the operational stuff, as the light bulb in the shower that's been out for a while. That comes from the maintenance budget, the operational budget. How come that it's taken a while? I can understand CIP because CIP is the big stuff, the ledge or the bond to fund those stuff. But what about the maintenance, the small stuff, the everyday items? Can't you fund that through your maintenance budget from out of your operational budget rather than CIP?
Yes, and that's Judge, that's what it's there for. And I don't want to make excuses, but just so you can understand some things. It's been rectified. The numbers are lower, but at one point, Maui, 25% of their operating budget was going to workers' comp.
Right.
And so if you look at OCCC right now, they have a big percentage as well going to workers' comp. I've asked some senators and representatives on the fly, is there a way we can change how the monies are actually funded? Because operationally you kill us, even though I understand the intent was to assure that management at the facilities would be more inclined to try to work with their workers' comp cases and get them back online if it was coming out of your operating funds. But in many instances, we get workers' comp cases that go on for a long time because it's managed by DHERD.
Okay, Mick, I need some clarification.
Sure.
First of all, in the operating budget for each facility, there is an item for repair and maintenance. Are you saying that money, because it's not CIP money, it's operational funds, is that money being used to pay for workers' comp and other things and not directed towards repair?
It's automatically taken for workers' comp, not from our decision. That's where workers' comp gets paid from through the repair funding mechanism.
Automatically?
Yes, that's not a decision we make. It comes from your operating funds.
I think it's simply taken from B fund, and then the operational program will have to make adjustments to its B fund allocation.
That's a nicer way to say it, Ed.
Yeah. And I think Mick is onto something here, because the thing that always kind of got to me was the line departments really have no say on who gets on workers' comp and how long they stay on workers' comp, but we have to pay. The department has to pay. And we all know of cases where staff would get on workers' comp and stay on there for years and years, although it was really clear they would never come back to work. But we still had to pay them. And by the way, the rate of pay is 67% of salary, as I recall.
Yeah, it's almost equal to their salary because they don't pay tax on it. So it's kind of it hurts us, but I can tell you, Judge, a light bulb in a shower that hasn't been replaced for weeks is unacceptable. I mean, that, you know, those kinds of things. I mean, a bad experience I had when I was sent back to OCCC, we had cells out. And as I prodded, they were out for a long time. It was simply $1.25 fuse that fixed it. So I think engagement, me trying to talk to people and push them more toward that engagement can handle and take care of some of these issues that you guys are seeing. There's really absolutely no reason we have long-term light bulbs out for months on end. We're not that poor.
Thank you.
I just wanted to make it clear to you, Ron, that it is operational funds for repair and maintenance. It is not CIP funds that are used for repair and maintenance.
Yeah, you know, Martha, what I was referring to, I wish I had it here. We get I forget the name of it, but we get like $3 million a year for out of CIP to handle the small, it's CIP, but it's not the real big planning projects and the multi-million-dollar ones. And that's what I meant when I said we do have some CIP money to address some of those smaller projects that can be done through a quick RFP, bring in a contractor and fix things.
It's a lump sum R&M or something like that, right?
Yeah.
That's what I was referring to.
Also, from our discussion with the maintenance supervisor, he did bring up some issues that, first of all, much of the equipment is old and they can no longer get replacement parts for it. And also that just like the building industry is facing shortages throughout the state, if they need to replace a toilet, they end up ordering it from the mainland and then it takes a long time to get here. And so there is no like supply closet that these people can go to and pull a toilet out of. They have to each time put in a separate request to get this equipment, which makes it
and Martha, one of the things that we face, and I know because I was there, we would have offenders breaking the porcelain toilets. But the reality was when OCCC was built, it was built with all stainless, but stainless is like 3 times the amount. So through the years, people began to buy porcelain instead, and that became problematic because you got to put a seat on it. I mean, sometimes it's just, I think, what I'm trying to say is I think people actually do care. They would like to get things the way that they really should be. The stainless steel bowls have the seat already molded into the stainless steel, so you're not replacing a toilet seat. I mean, I even get appalled when I go, how is someone supposed to use a porcelain toilet with no toilet seat on it? And sometimes it's triaging the amount of money people have and trying to figure out how to do the best that they can. I'm not making excuses. But I think a lot of people see exactly what everybody wants, and it's just difficult to move this system toward that outcome the way that it works.
I do want to comment on just one thing very quickly. I don't think it's a matter of staff not caring. I think staff care very deeply, and a lot of staff are actually pointing out some of these deficiencies to us, in order to try to get help for them. Honestly, I think that what it comes down to is staff become so used to the issues in these units. And I think at one point, staff were probably bringing attention to left and right. And then at one point, they just give up because it's not getting fixed.
Or it becomes the norm.
Or it becomes the norm.
And that's dangerous.
Stop coming in. And, so I think, Mick, with that prioritized list that then you and your team can kind of look over and ensure that things are either being prioritized for funding or whatever the situation may be. I think that'll be a helpful step. But I don't think it's a matter of staff not caring. I think staff are just getting burnt out with bringing the same thing up over and over and over and over again.
Yeah.
Mike here.
Yeah, go ahead, Mike.
I really like that the tone at the top is going to be collaborative, and I feel welcome hearing all of this. We're trying to do is solve the problem, not point finger or blame. And I like it when PSD doesn't play defense, but plays either offense or we're all on the same group here. I know it's a brand new relationship, but I hope this is productive. I don't know that we need to solve each problem. We just need to be awareness is key, and then the balance. And I hope we're not going to go away, and they're not going to go away. So let's keep working together.
I certainly appreciate that, Judge.
And repair and maintenance funds have been diverted for other things for decades. It's not new.
Much of the conversation today will help us to determine what a lot of the other conversations will be like. With that being said, number 10 is our final one today. We're really looking at how can PSD invite others in the criminal justice system, police chief, prosecutor, defense bar, judges, politicians to visit the correctional facility. And I know, I think the politicians just visited OCCC, if I'm not mistaken, Lance.
The Supreme Court.
You understand?
I helped set that up, actually. Yeah. So the commission found that much of OCCC's serious overcrowding is linked to those with low bail, serious mental health issues, those experiencing homelessness, and others who experience excessive trauma by being incarcerated. The commission recognizes PSD does not get to choose who they receive or who can be released. However, a greater effort can be made to work collectively with partners in the criminal justice system. Is there a particular discussion on this one? If PSD finds appropriate, the commission will assist in inviting, planning, and facilitating the tours with the support from facility staff for appropriate background check scheduling and guiding tours. That's just us helping to facilitate relationships and partnerships with PSD by showing them and educating them on the conditions of our facilities. Correct, Christian? Yeah, I put in the if PSD finds appropriate piece because Justice Wilson had reached out to me to help him plan a tour to OCCC. And so I worked with him, and then two other justices and also Senator Kidani had joined. And I worked closely with OCCC just to help, wrangle everybody together, find a time, et cetera, et cetera. And then I ended up going on that tour as well, just to give them context. Like, this is what I look for when I'm touring. This is kind of what facilities should look like if you're considering, ACA standards, different things like that. So, but it ended up being a great tour. I mean, Tommy was there as well. I think it was really impactful. And so I just wanted to make it clear that, I know it's a lot of work trying to get people into these facilities, and I know it's a lot of work planning and facilitating. So if we can be helpful in that realm, I didn't want to put it all on PSD. If PSD finds it appropriate, I can help with those things. I don't want to overstep. I just wanted to offer, that help if PSD finds it helpful.
Kristen, it's always helpful. And I'm not sure the judges could truly answer to this, but I know I've invited the district court judges to come because a lot of the cases come out of the district court as well. And it's helpful for them to see. I mean, my spiel to them was we were getting a lot of DUI cases at that time of young kids. And I was like, why would you want to put them in here for 3 days? Mm-hmm. This is going to be detrimental to their welfare. It really is unnecessary. And it gives them a taste and lets them see it. But I don't know if it would have really changed truly the behavior in 3 days to go in and come out. I do know the tour at HCCC with Judge Ibarra and Judge Kim, and forgive me, I forget the female judge's name. They were all very helpful, and willing to try to help with the overcrowding there as well. So I think, you know, there ain't nothing wrong if you can get people to come and just take a look and then let them go back and talk about how they may be able to help improve the system because of, you know, their work, and then how that contributes to the overall correctional community. So I think it's a good thing personally.
Yeah, last Friday, the Chief Justice of the Supreme Court came to the Big Island in honoring Justice Wilson and Justice Nakayama's retirement. And I got to speak to the CJ about, you know, the overcrowding and things like that. And I mentioned to him about, see, the judges have a judicial conference. It is only judges every year, and get the centralized training. All the judges, Supreme Court, Appellate Court, Circuit Court, District Court, Family Court, all gather and they get training. And I mentioned that, you know, there's judges, it's a good time judges about the conditions, what they can consider. I'm not telling how they should rule because there's a principle of judicial independence, but, you know, how they could consider making an impact in the prison overcrowding or jail overcrowding. And certainly he kind of mentioned it. We should take, he will address it with the Judicial Education Committee. And, you know, hopefully I'll follow up with him. But it's not only the judiciary, you know, it's pointed out here in the recommendation, the police chief, because the police by statute sets bail for certain type of misdemeanors. It's not the courts. Well, the courts have the final say, but pre-court, it's the police chief. And, you know, you got the prosecutor, you got the defense bar, and you got the politicians. So all the stakeholders in the system has to participate so we can support a common goal in changing this to a rehab system versus a punitive system. So everybody has to go.
Mm-hmm.
You know, I'd like to add something a little different to this. I think the other player who can be very impactful on this issue is the social and health services community, the private community out there. I think if they can be part of the discussion, perhaps we can have more services opening up for some relatively low-level offenders at OCCC, especially the homeless, active substance abusers, the mentally ill. They may be small in numbers, but they consume a lot of resources in the facility. And many of them, I would suspect that at least some of them could be placed in a setting in the community rather than in jail. And sometimes the courts or the police really see no alternative, or they don't understand it as an alternative. But I think there's a possibility of opening up a real rich relationship among the various players with this community.
Yeah, I agree strongly, Ted. Well said. Diversion programs, because the prosecutor is going to look where they're going to go.
Yeah. You know, we asked the question of the head of health services about what she sees every day, and she says what the number she gave was like 90% of people walking in are homeless, mentally ill, or actively using drugs. So, and this creates tremendous pressure on the facility.
Okay. We've kind of went through the recommendations. Any last words before we close?
Mark.
Go ahead,
Mark.
Ron.
Okay. On behalf, I make a motion to adopt the report as circulated and as discussed, subject to the correction of typographical errors, which Christian would correct prior to formally, publicizing it. So I make a motion to report as the commissioner's report.
I second that with kudos to Dr. Spellcheck.
To be fair, the spelling was correct. I just didn't take the draft piece off.
I just want to, give kudos to Christian as she's trying to learn how to write pigeon. But it's been moved and seconded. Let's have any further discussion on that motion. We want to make clear when we post this, Christian, and it can be done in our meetings, that we are in a working relationship with public safety in order to resolve some of these issues. And as we move along, we'll continue to report on where we are with them.
Amen.
Okay. Okay, all in favor say aye.
Aye.
All opposed say same. Motion passed. Okay. No further business, Christian?
No, the only other thing is that we do have the monthly commission meeting next Thursday, and friendly reminder to the public, we will all be flying to Kauai. And so we will have our public meeting in Kauai, and all the details are on the website. And then directly after that, we will grab some food and head to the facility.
Okay.
Kristen, just to for my clarification, I won't be able to join you on Kauai. I'll be out of state, but the public meeting will be first at the usual time. Okay.
So the public meeting, George, remind me. I think the public meeting had to be shifted to 10 a.m. to ensure that Ron can get over to Kauai from the Big Islands. Is that right?
Where's the meeting at?
Oahu Community College.
Okay. Okay.
And George is going to get there a little early, so he'll get the rental van and pick us all up.
Okay, that sounds like a plan. I want to thank Mick and Lance and whoever else from PSD to be here today and go over this with us, and for your feedback and your honesty. We will probably be doing this again. Maybe not the same players, some different ones, but just want to thank you all for being here, and we continue to move forward in our quest for change and reform. So thank you and aloha.
Thank you.
Thank you.
Thank you. Thank you.